All right, so this person had made a comment on my last video about a trauma response in regards to feelings of numbness, emotional numbness. And, with this comment, I really wanted to make sure that this was put out there because this was going to be another trauma response that I was going to post about and talk about. I've mentioned it before on another video, but it's important to re-mention it because it has a lot to do with a trauma response, and that's disassociation. So there's a lot of different forms of disassociation, and this person talks a little bit about being in part of a hospital where she wasn't aware of it, but her brain kind of took her to the parts of where she experienced her trauma, and then not being aware of it until later on, and that's called dissociative fugue, and that's something you guys can look up if you want to. Sometimes people can go years and come back to reality and not even know what they did for years. They have almost like a double life. It's really interesting. One of the reasons why I got into becoming a therapist in psychology is how interesting some of these things can be. But, anyways, another part of this is the disassociation called derealization. So it's where you feel like the reality that you're living in isn't real, or that you feel like you're in like a video game, or you feel like you're part of something, but it's not, like the reality that you're experiencing isn't something that's real. I know that sounds bizarre. You need to go look it up and read about it because it's fascinating. Again, that's called derealization, and I've been getting a lot of clients that have been experiencing this derealization. Again, it's a form of disassociation, but you feel like the environment that you're in, or the situation or whatever, isn't part of your reality. It's like you're there, but it's not real to you, if that makes any sense at all. And then the other one, the other part of disassociation is called depersonalization. And that one's really interesting. I've had a few people that have experienced that one, but that one is where you feel like a part of your body isn't really yours. So, like your hand or a foot, or I don't know, whatever it isn't a part of you. And I've had some people describe to me that there's a part of their body that doesn't feel like it's theirs. That was the part of their body that was traumatized. So that part of their body that was traumatized, they're like, that's not mine. That doesn't feel like it's part of me. Whatever that is. So really interesting things to consider when it comes to trauma responses. So if you just think about it, your brain is going to want to disassociate and is going to want to separate from the trauma. And clearly by, doing so, it can cause things to, for you to experience things that maybe you wouldn't normally have experienced, like your environment isn't real, or part of your body isn't real, or you can be in a different place for a period of time, and then come back to your senses, if you will, and your reality, and then realize that you've been gone for a while or been talking to somebody, and then you come back and you're like, whoa. I've had some people describe time lapses, which is really interesting too. Some of these gets into the realm of the metaphysical as well, so I don't discount that. It's just, when we're talking about trauma responses, I'm focusing mainly just on the mental health side of things. So it's all mental, but anyways. So let me know if you guys have experienced this kind of stuff as well. The disassociation types of things, depersonalization, derealization, dissociative fugue, whatever you want to, share would be, I think, helpful for a lot of people to kind of understand that that's what your mind and your body's going to do as a response to trauma. And what do you do with that is you continue to talk about these kind of events. It's not that much different than repression, where as you talk about them, you're supposed to kind of remember them, feel a sense of power and control over the traumatic event, and then eventually you get to a point where you heal from it and it doesn't have the kind of power and control over you as it once had. So anyways, let me know what you think. I appreciate it. Thank you.